Hello everyone and happy Monday. It's the Medicare Monday that I do every week. Today's edition is going to be shorter. Basically just going to talk about Part D, prescription drug portion of Medicare, a little bit of what Medicare is doing to, I guess, regulate the Part C and Part D Medicare companies, and I guess kind of a cautionary to everyone who is getting on the Medicare program or on Medicare currently in regards to drugs. So first things first, this new rule came out for Medicare Advantage and Part D. Now Medicare Advantage and Part D, that's Medicare Advantage is Part C, and Medicare Prescription Drug Plans is Part D. Both of these programs are run by private insurance companies and have a contract with Medicare to manage these plans. Unlike Medicare supplement plans, which are rules governed by original Medicare Part A and B, and the Medicare supplement plan is simply a financial insurance product made to cover gaps, that's Medigap. These programs are actually the health plan that manages your care, not just pays for your care in the case of a Medigap plan. Now what they've done here was they're trying to make drug costs and I guess the cost that you pay at the pharmacy more transparent. Now I know that's going to sound really odd because you think that it's pretty transparent, as the price you pay is the price that is fair. That is unfortunately not the case. One of the articles here, or not articles, sorry, one of the points that they make, now this is unpublished yet, so the unpublished PDF is over 600 pages and almost impossible to navigate, but the summary that they provide here on their website is quite good. And what they're saying is they want to lower the beneficiary cost sharing at the pharmacy counter, and what they're going to do is apply any price concessions that they receive from the network to the plan and pass through the beneficiary. Right now we have this middleman entity called a PBM, which is a pharmacy benefits manager, and they receive a cut of said medicine whenever a transaction occurs. And an insurance company is like a piggyback on top of that. So what this rule is going to do is it increases the market transparency and competition for medications picked up at the pharmacy. Now that doesn't solve a problem, which I've found and many of my clients have found, and that is that the actual price fluctuation of the medication that you pick up fully transparent and at the pharmacy counter can change. And this article here goes over for a woman who retires. She is 73. She picks up a drug plan. It could be, they talk about Humana here, but it could be any drug plan. And using the price comparison tool, which is the tool that I use, that's the data is provided through Medicare.gov, she found that she was expected to pay $70.09 for her dextroamphetamine, which is a stimulant used to treat ADHD in her case. And the pharmacist said, oh, it's $275.90. That's huge. That's almost 4 times as much as she was expecting to pay. And she didn't pick it up. Now, if you know anything about medication, especially medication like this, without it, some people can't function. And not to say just saying this medication itself, but there's lots of medication that out there that if you don't take, you will not be able to function. And what this lady is saying is that she purchased this plan thinking that this was going to be her cost for the medication. There's nothing she can do right now because of, right, you don't have an election period to change. So what what should she do? Should she not pay the premium for the plan, cancel the plan because they didn't make good on their part? Well, if she does that, then she'll have no drug plan, and she'll also incur a penalty the next time she enrolls, right? So she can't do that. So what can you do? You are literally stuck. And she said that through this 3 months that she's been on this plan, she already has paid $433 more than the cost estimator did. And what they're saying is that the reason why this is so, and the information comes directly from Medicare.gov, is that these amounts may vary throughout the year due to changes in the drug's total cost. So what this means is that the drug manufacturer could change the price of the drug. Now, according to the article that I was just reading, most times these pharmacy companies change the price of the medications during the month of January and the month of July. But that's not set in stone. They can change it whenever they want. In addition, the drug plan can change and modify the tier. That means how much of the cost share the member has to pay, and also the coverage of a medication if a generic becomes available, or if there's another medication that comes to market that the plan gets a better deal for. Now, both of those situations aren't going to be good for people who make their, I guess you could say, their plan based on the cost estimator, which is what I do for my clients. But I do it fully understanding that this is really the only thing you can do outside of just throwing a dart and picking a plan, because there is nothing else you can do. Now, with luck and with a little bit of all these different agencies pushing for more transparency, I guess a better stability on prices, that will change and will have better Medicare Part D drug plan coverages. The last thing I wanted to talk about was when you're on a group plan. This particular article talks about how employer-sponsored health plans have to deal with very expensive medications. So for those of you that were on or have really expensive medications now that you're retired, those medications didn't get expensive. It's just that the cost sharing changed from when you're on the group plan to now that you're on Medicare. When you're on the group plan has all the premium to pull from in order to pay for the drugs. On Medicare, you only have the drug portion of the plan to pay for the drugs. In addition, employer-sponsored plans have much less bargaining power than Medicare does, but they also have far less time to deal with many of these issues. So essentially, the company itself would just eat all the costs, meaning that if you were on a plan sponsored by, let's say, insurance company XYZ, insurance company XYZ looks at the plan and says, wow, you have a lot of unhealthy employees who are using a lot of medical services. We are just going to charge you more next year for your plan. And the company group plan has to just say yes or no, we'll go shopping somewhere else, and that's when you might have a change in plan. When you're on the Medicare program, all of this stuff is finite, right? So if prices increase on the consumption side as a whole, the entirety of the market has to increase on that same kind of scale. Now you might think, well, how come when I was in the group plan paid for so much more and I paid very little for my insurance? And that's because if you're in Hawaii or if you're in California, the state labor departments have so much power that you are only paying for maybe 1% of the health plan's cost. So in the very near future, many of these employer plans are going to slowly look more and more like Medicare. So you're going to start hearing about people who have retiree plans on the group side that are potentially getting really expensive and maybe even dwarfing costs that are on the original Medicare or Part D and C, because of the fact that they'll have less bargaining power. So where am I going with this? Well, what I'm trying to say is that there's going to be a lot of legislation, lots of new things that companies and insurance companies and legislation is going to push out. For you folks on Medicare, the best thing you can do is keep kind of in the loop. But also, if you are someone who writes into your congressman or writes into anyone in the legislature or writes into any of these advocacy programs, please do. If you experience problems with your Part D drug plan, call them up and ask to speak to their grievances department. It used to be much more difficult to get in touch with the grievances department, but now if you're on a recorded line and you say you'd like to file a grievance typically means that you are unhappy with the way that this company handled your claim. This is for Medicare Part C and Medicare Part D. And what that does is it kind of throws a negative or a red flag at this company and says, hey, you're not doing what you promised to do. Let's do something about it. Because unless those kinds of complaints come in, Medicare and its oversight as far as its regulation of these private companies has really no idea what's going on. And that is the major problem with a lot of the plans out there, because there's no real advocates for these beneficiaries, and every year they change their Part D plan, change their Part C plan. So there's a lack of really any kind of consistency. And like if I had to change plan every year, I really wouldn't in my head be able to give a good reason for complaining, right? Because it's only a year. But every time there's a problem, complain. And it's not because you want to be a complainer, but it's because you want the legislation to go in a way that's going to benefit you, and it's going to show that the way that the companies are managing their drug plan, their benefit plan right now isn't working. But on the flip side, if they are doing something right, also let them know so that they can kind of feel good about doing this. And at the end of the day, all of these prior authorizations, benefits, the amount of money you pay at the pharmacy, all of those things are governed by people. Policy is written by people. So please just do your best. Let people know what's going on. And that's about it. If you guys didn't see the video I posted on Friday, it was about long-term care. That's on my retirement kind of resources videos that I do on Fridays. That video is going to be more about, or those videos are going to be more about investing, long-term care, annuities, 401ks, things of that nature. And the Monday video is going to be specifically for Medicare and updates. But if you're interested in learning about more retirement related things, check out that video that I posted on Friday. You guys have a great week, and if you want to see different things on this channel, different Medicare related news, let me know. I'll be more than happy to do some research for you folks, and I'll see you in the next video. Bye bye now.